borderline personality disorder and narcissistic personality disorder. These two often get mixed up, misunderstood, or inaccurately thrown around. And honestly, it's understandable. On the surface, both can involve intense emotions, big reactions, and struggles in relationships. But if you look just a little bit closer, you'll see they're driven by very different fears. So today, we're going to examine some real-life situations where BPD and NPD can show up and show you how they often lead to much different outcomes. So the first scenario we're going to unpack is a friend setting a boundary. A friend says, hey, look, having to help you with your emotional emergencies every night is really starting to take a toll on me. And I can't always be the person that you call every time you're freaking out. So for someone struggling with NPD, this may be received as humiliation. To them, boundaries often feel like disrespect or rejection. And so instead of recognizing the friend's need for self-care, the person with NPD might see the boundary as proof that they are losing control or admiration. They may react with anger, belittlement, or even emotional withdrawal as a way to punish the friend or regain dominance. For someone with BPD, this boundary can feel like a confirmation of their worst fear, that they are too much and will inevitably drive people away. Someone with BPD may experience overwhelming shame and guilt because they interpret the boundary not as a neutral request, but as a rejection. They might respond with frenetic apologies, withdraw to avoid perceived rejection, or even internalize the situation as evidence that they're unlovable. The key difference? The NPD reaction is often about defending self-esteem. The BPD reaction is about fearing abandonment. Before we get into the next scenario, I want to take a second to be very clear about what these two disorders are. Narcissistic personality disorder, or NPD, is a mental health condition characterized by a pattern of grandiosity, a deep need for admiration, and difficulties with empathy. But underneath the surface, there's often a fragile and unstable sense of self-esteem. Now, borderline personality disorder, or BPD, is marked by emotional instability, intense fear of abandonment, chronic feelings of emptiness, and unstable relationships. At the heart of BPD is often an attachment wound, a deeply rooted fear of being rejected, left, or unloved. This can lead to intense emotional reaction and almost frenzied efforts to avoid abandonment. Both disorders can cause significant emotional pain, not just for the people living with them, but also for the people around them. And while they may sometimes look similar on the outside, their core fears and emotional needs are actually really different. All right, now let's move into the next situation, achieving success. The scenario for this one is both people receiving a big promotion at work. The NPD response here is pride that quickly shifts to a need for external recognition. To them, success is only valuable if it's admired, envied, or validated by others. People with NPD often struggle with internal feelings of inadequacy, so achievements are really used to temporarily prop up their fragile self-esteem. They may boast, subtly compete, or focus on making sure everyone notices. The pressure to maintain this external image is constant. For someone with BPD, success can also be destabilizing, but for very different reasons. Many people with BPD struggle with chronic feelings of emptiness or identity disturbance. The promotion might spark imposter syndrome or even fear of rejection from colleagues who they believe might now resent them. They might worry that they don't actually deserve it and could even unconsciously sabotage their own success. Where NPD seeks to guard against perceived inferiority, those with BPD may feel alienated by the achievement itself. Now let's move on to situation 3. A romantic partner forgets an anniversary. Someone with NPD may initially act indifferent or almost above it, but internally they could be furious. Forgetting an anniversary just isn't disappointing, it threatens their self-image as someone deserving special attention. Because people with NPD often regulate their self-esteem externally, the partner's forgetfulness feels like an unacceptable insult. They may seek revenge, emotionally punish their partner, or fish for grand gestures to restore their sense of importance. Someone with BPD might also stay quiet at first, but for a different reason. They might feel crushed, flooded with feelings of worthlessness and panic. Their partner's forgetfulness may confirm their belief that they are unlovable and destined to be left. This isn't about entitlement to attention. It's more about a survival level fear of losing the relationship altogether. Both may look outwardly calm, but inside, one is focused on wounded pride, the other on overwhelming fear of abandonment. The last scenario that we'll talk about today is being asked to compromise in a relationship. Imagine a partner says, I really enjoy how we spend our weekends together, but lately I've been feeling like I need to kind of bake in some more alone time here and there to recharge. How can we find a middle ground? For someone with NPD, this request may feel like an unreasonable demand or even a rejection. Compromise can threaten their sense of control or entitlement in the relationship. Instead of hearing it as a healthy mutual adjustment, they may interpret it as the partner pulling away, disrespecting them, or not valuing their needs enough. In response, they might resist the compromise entirely, insist that their way is the only way, or use guilt and manipulation to get the partner to back down, all in an attempt to reassert control and maintain superiority in the dynamic. For someone with BPD, this request could immediately trigger fear. Even a small adjustment, like wanting alone time, might be interpreted as a sign that the partner is drifting away or preparing to leave. Instead of seeing it as a normal relationship need, they may experience it as overwhelming anxiety, self-blame, or panic. Their response might involve clinging tighter, offering extreme concessions out of fear, or emotionally withdrawing to avoid the perceived rejection. The compromise isn't just a scheduling issue, it can feel like the beginning of losing the relationship entirely. Supporting someone with BPD or NPD can be challenging. These patterns often take time to shift, and therapy is usually a long-term process, but there are ways to make progress. For people with BPD, one of the most effective treatments is dialectical behavioral therapy, or DBT. DBT helps by directly targeting the emotional struggles at the heart of borderline personality disorder. People with BPD often feel emotions so intensely that it can feel impossible to control. And so DBT gives them practical tools to slow down and ride those emotional waves without getting pulled in. For example, instead of reacting impulsively during a fight or pulling away out of fear, DBT teaches people how to recognize what they're feeling, tolerate that distress, and choose a response that actually helps them keep the relationship intact. For people with narcissistic personality disorder, the challenge often starts with getting them into therapy at all. Many people with NPD don't think they really need help or might feel too ashamed to admit that they're struggling. But if they do engage, cognitive behavioral therapy, or CBT, can be super helpful. At the core of NPD, people often rely on defenses like needing constant admiration, dismissing criticism, or controlling situations. Not because they're bad, but because it's how they've learned to avoid shame and feelings of inadequacy. CBT helps by breaking these patterns down. It teaches people to notice their automatic thoughts, really question whether those thoughts are actually helping or possibly hurting them, and then experiment with new ways of thinking and acting. So in the end, while BPD and NPD can sometimes look like two sides of the same coin, they are at their core driven by entirely different forces. One by the desperate fear of being left behind, the other by the relentless need to be seen as superior. Understanding this difference isn't just about labels, it's about compassion. It's about really recognizing that behind the reactions, whether it's anger, withdrawal, panic, or clinging, are very human attempts to survive overwhelming emotions. And with the right support, patience, and treatment, those caught in these patterns can begin to build relationships that feel less confusing and painful, and a little bit more steady, connected, and real. Thanks so much for watching. I hope that this video resolved any confusions you might have had regarding these personality disorders. We always have more resources on our website if you want to keep that learning journey going. And if you feel that you or your loved one might need more help, please click the first link in the description to schedule a chat with us here. Thanks so much, all. We'll see you next time.